the orthoPAC, hosted by Sam Dyer. Welcome to the orthoPAC, where we discuss up-to-date orthopedic topics for the busy clinician. I invite you to sit back and relax as I attempt to fill in the gaps between education, current events, and real-world practice.
Hello, listeners, and welcome back to our podcast. Today, I have another episode on the AMA Scope Creep campaign. This will be the last one I do on this topic for now, unless something more relevant comes up, but I do have a few more thoughts I wanted to share with you. If you haven't listened to these, I invite you to go back and pick up the last episodes on our YouTube channel, PAs and Orthopedic Surgery. The first podcast on this topic was August 28th, and the second was September the 11th. These podcasts shed some light on the AMA Scope Creep campaign and my views on it. I hope you have found this information valuable, and I also hope that you are as alarmed as I am with the extent that these folks are going to block PA-favorable legislation in multiple states. Their goal is to not only ban legislation on scope of practice, but also propose changes be made to PA's ability to switch specialties. A NCCPA representative told us at our meeting last week that 54% of PAs switch specialties at some point of their career, and the AMA wants to change all of that. You, listeners, must take some time and educate yourself about this issue. So on today's podcast, I want to do one more follow-up on this topic and discuss some things I found with further research. First, let me correct information from my last podcast. The AMA Board of Trustees has 20 medical doctors, and the other person is an executive director who has worked for multiple large corporations. Also, we had an initial misprint on last week's title, which has been corrected. And to any physicians listening to this podcast, I want to say this. Please realize that none of us want to be you. I didn't want nor need to spend 16,000 hours in school and training to do what I do today. I do not need to be a clinical scientist to give great patient health care. I don't claim to be able to do surgery by myself, nor would I ever attempt to do so. I'm sure my colleagues and other subspecialties feel the same way. But please ask yourself this, and if you're being honest, do you really need 12,000 to 16,000 hours of training to safely manage an ankle sprain, a buccal fracture, a gastric virus? I've said it before, and I will say it until I'm blue in the face. You don't need that much training to handle most conditions that patients present with. Dr. Eugene Stead knew this, and is why he started the PA profession, by training Army medics and hospital corpsmen. I took this to heart after spending 6 years in the Navy as a hospital corpsman myself, which is why I am where I am today. You know, the more difficult and complex cases, absolutely a medical doctor, 100% of the time. Surgical procedures requiring specific technical expertise, absolutely a surgeon, 100% of the time. The real key for a PA is knowing the difference in what they can treat and what they need to send out or get help with. I believe that PAs do know this, and we know what we can do and what we cannot. That's the hallmark of being a good clinician. Okay, so on with the meat, so to speak, of this podcast. I looked up and read all of the AMA Board of Trustees biographies listed on the AMA website. I didn't know this, but there are orthopedic surgeons on that board. I then took their specific information and did a search to see where they practiced. My idea was I wanted to know if these folks actually have contact or experience with PAs or where PAs are employed. And the answer is the majority of them practice in locations that either employ PAs or are listed on staff in institutions where PA studies are taught. At least 4 or 5 of them work in or own a practice that employs a PA. If you are a physician in a practice working with a PA on the team, and then as an AMA Board of Trustees subsequently spread misinformation on PAs and patient safety, well, shame on you. Shame on you for putting out a toxic rhetoric that PAs are unable to provide safe patient care and advertising this lie to patients while simultaneously employing us. If you feel that way, then personally, I don't want to work with you. I'm not calling anyone out individually, but if you do your due diligence and look up this information on the AMA website, you'll see that I am correct. The AMA talks about how patients are confused from not knowing if they are seeing a PA or an MD by asking questions like, are you getting good care? Make sure you know who you're seeing when you go for an appointment, and it's okay to ask. I agree that patients have the right to understand who they are seeing and knowing that person's qualifications up front. I personally read about the qualifications of anyone I see on a professional basis, be it medical, legal, or financial. However, when you phrase the question the way that the AMA phrases it, and support national and state organizations that post smear campaigns on highway billboards, who is creating patient confusion in that instance? I guess these people never learned the lesson that my mentor taught me 30 years ago. He said, never, ever, ever discuss another provider's perceived lack of competence, they're a mistake, or a practice issue in front of a patient. If you have something negative to say, keep it to yourself until you're in a private conversation with your colleagues. When you do what my mom called bad-mouthing someone publicly, either a colleague or other healthcare team member in front of, or even worse, to a patient, you create patient skepticism and distrust of the entire team. Not only the team, but the practice and the healthcare system. These people should go back and listen to a podcast I did with a couple of defense attorneys a few years ago. This type of toxic, negative rhetoric in front of and or to patients is the main reason why all malpractice lawsuits happen in the first place. It's just bad business, yet the AMA continues to do it. As I have said several times, in my opinion, the AMA Board of Trustees is letting fear of losing market share and a desire for monetary gain get in the way of developing strong, collaborative working relationships within their healthcare team. Additionally, PAs working in collaboration with physicians in an optimal team practice environment could be a way to address the physician shortages across the United States. In so doing, this could necessarily help reduce physician burnout. Let me repeat some information from my last podcast. According to the American Association of Medical Colleges, or the AAMC, report this year, physician burnout not only affects the physicians themselves, but it also affects the quality of the patient health care they provide. I've also already discussed the tremendously horrible reality of physician suicide called a silent epidemic by the NIH. That it is a systemic problem created by hours of overwork, overly burdensome administrative duties, substance abuse and mental health, as well as a lack of resources for physician wellness. So let me be crystal clear on this, and any physicians listening to my podcast. Doctors, your American Medical Association played a significant role in the current national shortage of physicians. Now they are pushing another incredibly bad policy that affects not only PAs, but also patients. How? By limiting patient access to see a provider in a timely manner. This is especially true for patients in rural and urban communities with fewer resources. The AMA maintains a steadfast opposition to a potential solution, even though physician burnout and risk of suicide are present. Yet as their website states, they are, quote, fighting for physicians, close quote. You know what I think? I think this is both ironic and incredibly sad at the same time. This scope creep campaign is wrong, folks, and it needs to stop. Another point that these people don't talk much about is that PA scope of practice was greatly expanded during the COVID pandemic when we needed more caregivers. But now that the pandemic is over, the AMA wants to revert to the draconian hierarchy from the past. So during a crisis, PAs are called on to do more and open their scope of practice, and then when the crisis is over, we suddenly became inept and cannot do the same task because we aren't safe for our patients? Come on, really? The question I would ask you, listener, and the AMA is this. Does maintaining an overly burdensome restriction on scope of practice and practice patterns solve anything but protect market share? I certainly do not believe it does anything to promote public health and patient access to care, and I think I have presented more than enough evidence of this to support the case. Look, let me be clear. I really don't want to seem like I'm anti-physician, and quite the contrary, I'm 100% pro-physician. What I am anti is the AMA policy and the smear campaign against PAs and patient safety. As I said early in the podcast, it is alarming, sad, ironic, and just terrible to hear about physician burnout and physician suicide. I think it is a tragedy, and I want to do whatever I can to make it stop. I want to work as a team with my doc, practicing within my training and expertise, and make it a positive experience for both of us as well as our patients. I have no intention of being a physician. I made that choice well before I went to PA school. I want to be a PA, and that's all. I think there is a national need for PAs to practice at their full capability to help address the healthcare shortage of providers. But what we really have to get away from is all this negative energy and rhetoric focused on market share and a draconian hierarchical model that does not serve the healthcare team or the patient's interest. Let me close with a couple of quotes from Dr. Eugene Stead and Dr. Alan Berger, and follow that with a few sound bites from our prior CME conferences. The quotes from these conferences are unsolicited opinions provided by doctors about their relationships with their PAs and what they think about PAs in general. This is from Dr. Stead. Medicine is thought of as a very illustrious profession, yet it's not that difficult to learn. Thus, the commonly associated arrogance of physicians has always irritated the heck out of me. And here are a couple of quotes from an article of the AAMC written by Dr. Alan Berger. The most critical variable in the development of arrogance is a physician's knowledge and thereby his or her power over the patient. This can delude some physicians into imagining that they are all powerful. Dr. Berger then concludes the article by reminding his fellow physicians that we should not exaggerate our own importance. We are but an instrument of healing and not its source.
We as orthopedic surgeons really are indebted to how much help and care you guys give us in our care for our patients and making our clinics work well, and also really being a part of a whole team that provides the care that we give to all of our patients. So for all the orthopedic surgeons, we do just thank you for your care and your willingness to participate with us and your skill. So thank you very much, and it's quite an honor for me to be here.
Through my military career, I had the very distinct pleasure of getting to meet, serve, and work with many of you today. It was honestly a great honor of the first half of my career.
Seriously, you guys have an amazing opportunity to forge incredible relationships with the surgeons you work with. Jeff and I both started when we were at Fort Hood in 2005 when I was just first coming out of residency before I started fellowship. That relationship that we formed was very special. I trusted him with everything, spent more time with him than I think I even spent with my spouse or kids. And that relationship really becomes very special. It becomes very deep, a very deep trusting relationship. And certainly I feel like I learned a lot from Jeff and far more than just orthopedics.
To the doctors that said these things, I appreciate you tremendously and thank you for understanding PAs and the roles that we play both in collaboration with you and delivering quality care. Coming up next week, you get a fresh voice and we get back to the clinical side of things. Chuck Dowell is going to bring us a new presentation on an interesting case. The Ortho Bootcamp is coming soon to Charlotte this November. Sign up today.